So the condition itself pushes you to self-stigmatize, because if you're depressed, if you're anxious, you are going to be thinking about yourself and in a critical way, in a self-critical way. So anything that you can detect that you feel is wrong with you is going to be amplified by the very condition that we're trying to help you with. So
Yes.
that's another important thing. So the condition itself becomes a barrier to seeking.
Hello and welcome to this week's episode of the Burnt Chef Journal, a hospitality-specific podcast dedicated to challenging mental health stigma and conversations designed to inspire a new, healthier, happier, and more sustainable hospitality profession. Welcome to another episode of the Burnt Chef Journal podcast. Today, I'm very excited to welcome Dr. Andres Fonseca, a consultant psychiatrist, entrepreneur, and the CEO and co-founder of Thrive. With a passion for making mental health support more accessible, Andres has combined clinical expertise with digital innovation to create tools that genuinely help people take control of their being. Through Thrive, he's been instrumental in supporting communities across the UK, including those working in the high-pressure world of hospitality. We've been working with Thrive now for a number of years, and I'm very excited to be able to welcome Andres to the podcast today. Hi, Andres.
Hello. Thanks for the introduction. I'm glad to be here.
Well, thank you very much for joining me. I appreciate you're a very, very busy man. I was doing a little bit of research on you just to get a little bit more information, and I've seen quite a lot of various articles, business articles, as well as scientific journals, etc., that you've featured on. You're very highly regarded in this space, so I appreciate that you're probably quite busy.
I am quite busy. I don't know how highly regarded I am. I mean, I try my best, but yeah, thank you.
So take us back a little bit first. So for those who haven't heard of you before we come on to Thrive and your impetus behind that, what is your background? Where did you train? What led you into the profession that you're in currently?
Yeah, no, I trained as a psychiatrist in London, in the North London UCL rotation. So I spent my time in UCLH and the hospitals in the rotation, including the Royal Free and all of the hospitals that were part of that rotation. And finishing my training, I became dual qualified in adult psychiatry and old age psychiatry, so general psychiatry and old age psychiatry. And then I started working for the NHS. I became a consultant in the NHS, and I had a patch. The area that I covered was quite a rural area, and I discovered in myself, as soon as I became a specialist, that I had an interest in service development. There were two things that caught my attention back then. One was that I was getting referrals I was in old age then, so the post was an old age psychiatry post. But there were referrals from GPs asking about people with young onset dementia. So people who were below the age of 65 that had developed cognitive symptoms, and the GPs didn't know what to do with them. And of course, old age psychiatry is the specialty that deals with dementia in general. And the other thing that I discovered is that in my very rural area, my patients were on average aged 80, and they had to travel all the way down to the hospital, and I didn't feel that was fair on them. A lot of them couldn't drive, so it was quite hard. So I thought I would set up a series of satellite clinics in the GP surgeries in the local village to try and help them reach the service much more easily. And both of those things proved to be impossible. I mean, I did create the young onset clinic and kind of worked. It worked for about a year until we fell afoul of things that were to do with the relationship between the acute trust and the mental health trust, because I had to use the time of neurologists in the acute trust and neuroradiologists in the acute trust to do the job. And there was no way that we could get an agreement between the two entities to try and collaborate to do this clinic that was very much in demand from the GPs, as I said. So I tried to do that, and even though we did run it like in a clandestine way, I would say, for a while, when we tried to sort of make it official and everything else, we kind of fell afoul of certain things, and it couldn't progress. And the other thing that I confronted when I was trying to do my satellite clinics is things like how the notes were conveyed, and very simple things that should be easy to solve were impossible. So there were barrier after barrier after barrier. I was talking to managers to try and sort it out. And then when I thought I was getting somewhere, the managers would change, and then I would have to start again. So I became quite frustrated with all that. And because I did have this passion for creating services, I looked to the independent sector. And I don't know if you know much about the independent sector, but the independent sector takes patients from the NHS, that you're contracted by the NHS, very similarly to how GPs are not they are independent entities that have a contract with the NHS. That's what a GP is like. So in our case, it was an independent company, an independent service provider that had a contract with the NHS for the provision of mental health services. They were all inpatient services, but the appeal there is that you could take in NHS patients, but you could design the service in whichever way you thought was best. And so long as you provided high quality service, you were fine. So you had to come up to certain standards, of course, very much in favor of that, but you could organize it in whichever way you wanted. So that's when I met my co-founder for Thrive, Adam Huxley, who's a consultant clinical and forensic psychologist. And we developed services for anything from children all the way to adults and even elderly people, these kind of very, very specialized services. So that was very exciting. And we started, there was like 7 hospitals and facilities that we had. And then by the time our time was done, it was about 75, 80 that we had developed. So that was quite a remarkable growth. That taught me a lot of things about how to create a service, for example, how to run it, how to do all the kinds of things that one needs to do in order to develop something from the ground up, really. And then I had a very good partnership with Adam. And then we decided to try and extend our services, not just to inpatient services, but to the community. For us, early detection and early intervention was very important, was what the game was, to try and avoid people from being, becoming more and more severe and not being able to sort of find the right care and the right service at the right time. That then might lead in some cases to ending up in hospital. So, to try and avoid those kinds of outcomes, but also to accept the fact that there's a lot of people that are completely underserved that never quite even seek help or receive any help, but they are significantly symptomatic and actually suffering. So we decided to sort of look at that. We felt that it needed to be scalable. You can never train enough psychologists to do the whole job. So how do we do this scalable? How do we democratize this? How do we make access easier, better, more in the terms of what works for the patient than what works for us? So we had this thing about, so all the services are organized so that I'm sitting very comfortably in my office with my cup of tea. Great. And then a patient has to travel. This is the thing that I was trying to avoid for my elderly patients in this rural area. And they have to come at the hours when some of them are working, their parents, they've got lives. And then they have to flex everything in order to come and see me. And I thought that's backward. We need to sort of do better. And that's why we decided the digital layer of what then became Thrive. And then in 2018, we added the access to therapy. So we started in 2016, really, with a digital offering. And then 2 years later, we just integrated it with the layer so that we could offer therapy. And the point was so that people could rapidly sign onto the service. If they screen positive for depression or anxiety, they would very rapidly come on to see one of our therapists. They would receive a quick assessment and we would decide what to do. So some of them are eligible for just guided self-help. They're kind of fine. They may be subsymptomatic, but there's things that they need to sort out. Sometimes we do with them what I call guided self-help. So they're still following a self-guided program, but they are supported by a therapist. And sometimes, the majority of times for us, they go into our therapy program supported by the technology. And that's how we do it. And that was important to us. We couldn't do it internally. We did propose this to the company that we were working for, but it didn't fit their model. So that's why we decided to come out and found Thrive. And that was our plan, to try and increase the accessibility of these services, decrease the cost of them as much as possible so that more people could access them and more people could access them as early as possible so that we could get the best outcome possible for individuals. That's kind of the story in a nutshell.
And then you summarized it beautifully. And I think there's a few things in there that I just want to speak about from my personal experience as well as from the Burnt Chef project. And you talk about that barrier to entry in terms of being, certainly from a travel perspective, being quite challenging. Yeah. But I think from my personal experience, so there was 2 things. The early identification wasn't there. I waited until ultimately crisis point until I sought help. But then the stigma and the shame associated, and also the uncomfortable nature of having to travel, find someone. So I booked it was a cognitive behavioral therapist. Yes. And I lived in Somerset. I booked them in Bournemouth, away from anyone that could potentially know who the therapist was. And even when I got to the therapist's office, I sat in the car for half an hour checking my mirrors to make sure that I hadn't been followed there, which it sounds ludicrous, but that's genuinely how powerful the stigma was.
Yeah.
So by having something, and the reason why Thrive appealed to us as an organization and why we work with our clients by providing Thrive, is the fact that first and foremost, that early identification that puts you in front of a triage therapist is phenomenal, because often enough, we were talking earlier off air about how in many mental health conditions, especially within hospitality, we wait until it gets really, really, really bad, which then requires a lot more work and takes a longer recovery time. Mm-hmm. Whereas to be able to identify early and then immediately be put in front of a triage therapist who can have a conversation with you, go through an assessment, and provide you within that moment support that you need is a complete game changer, especially when it comes down to my personal experience. And so how's the last few years been for you? I mean, 2016, that sort of service came online. What's happened since then?
Yeah, so 2018, we introduced the therapy layer, and then we've been expanding that. And then we introduced that self-help. So initially, we just did therapy, but we saw that some people would benefit and wanted to, because it's quite empowering. So if you could do it yourself, you would, right? So a lot of people do want the support, and it's kind of similar to when you go to the gym. So you actually do better. So, I mean, there might be techniques that you can do on your own and improve your health, et cetera, but to get the right motivation and to actually help you navigate when you hit any kind of a barrier or a challenge, it is important to have a person there to sort of support you. So we introduced this hybrid model where it's guided self-help, basically. So we have a program within the app that you can follow, and it is based on cognitive behavioral therapy, and that will help you recover. So if you do the training there, it is an effort and it is an investment of your time. But if you do it, then we have the evidence to support the fact that you will recover. Yeah. However, to get yourself motivated and to get yourself through the program, sometimes you do need that guiding hand, and sometimes you get into a rut or things don't click. And then that's where that person comes in to sort of help you navigate those difficulties, but also to have a commitment to do it, to sort of say, by this day, I will be doing this. And then, we can discuss your progress, et cetera, et cetera. And then obviously we still have, and actually is the majority of activity, the therapy program. We expanded to sort of work with as many different industries as we could. So our mission was to try and go as wide as possible to offer this to as many people as possible. So we work with employers, but we've also worked with charities. And some of the charities that we work with have a mission, for example, for reducing suicide risk. You probably know that the demographic that is most affected by suicide is men. So some very, very particular interventions here that trying to reduce that risk. But also we know that anxiety and depression, the majority of those affected are women. So you have to sort of have those two things in mind, yeah? And you have to design the service so that you cater to all of that. And that's what we've been learning and we've been working on for the past few years. During the pandemic, we had a great surge in the demand for our services, obviously, because nobody could go anywhere. But also, I mean, that was helpful because there were a lot of people that were skeptic about doing therapy online. And that kind of helped people sort of understand that you could get good results by doing it online, doing it like we're doing it now, this podcast. And the evidence at that time, we were able to accumulate good evidence that there was no inferiority with actual face-to-face interventions. So for the majority of cases, there are some specific cases that might require face-to-face. And that's the other thing that obviously we have been working with, which is that in some cases, you are working with a therapist and we know that you may need more than what we can offer online in this setting. So we then our role changes slightly in that we become advocates and to help you seek the right help that you need. So a lot of people don't know how to obtain that next tier help, as it were. Mm-hmm. And we are the experts in that domain. So we help you navigate the complexities and the barriers that will be put in your way to try and get there. But what you said about the stigma really resonates. And I mean, I think it's improved over the years, but there's still that reluctance from some people to be able to seek help. And that still constitutes that problem that you were saying. So people may wait until things have gotten quite bad before they seek help. So that's another area that we've been also trying to work with. And how do we make the service as accessible, as anonymized as possible so that people trust it and people are willing to put themselves forward when they need help, and then they can get that guidance. Or sometimes it's just that reassurance. So even if you're not really sure of how you should approach something, it's about making that first contact with one of our therapists, and then they might guide you as to what the right level of support that you need is. And that's important.
Yeah, it is. Both of us, we travel a lot. We spend a lot of time talking about mental health and well-being on a global scale. And even now, when I check in with myself and I'm stood up in front of a stage for people and I'm sharing my experience, that stigma is still there. You still feel it. That niggle isn't there that goes, well, what happens if someone thinks that I'm really weak? And you go, and this is for us as professionals in this space. Obviously, you're a doctor, so you're much more qualified than I am to speak about these things. But it's still there. And when you think about it, that's completely normal. It's completely natural. When you look back in history, and they were having holes drilled in skulls to let the demons out, and all of this stuff over hundreds of years, it's not going to be eroded in the space of 10, 15, 20 years of us progressing in this field. But by having a service like Thrive, it gives people a easier and lower barrier to entry to be able to get that help, and just to be able to sense check it as well and say, am I wrong for asking for help? No, you're not. You're perfectly fine. And this is where we're here to help you. And well done. That's really encouraging.
I think that's true. I think what you said is also important. So there might be some, and there is, I fully acknowledge that there is some degree of stigma in society in general, but a lot of people self-stigmatize as well, which is an important factor. So the condition itself pushes you to self-stigmatize, because if you're depressed, if you're anxious, you are going to be thinking about yourself, and in a critical way, in a self-critical way. So anything that you can detect that you feel is wrong with you is going to be amplified by the very condition that we're trying to help you with. So that's another important thing. So the condition itself becomes a barrier to seeking help in both cases. So if you're very anxious, what's going to happen? Who am I going to meet? What are they going to do? All of these anticipatory anxiety will be sort of in the back of your mind, preventing you maybe from taking that first step. And if you're very depressed, if you're very low, if you think very lowly of yourself, it could be one or two things. Am I actually worth the help? Is one of the questions that maybe people think about. Or what you were saying, I've already feel like I'm the least worthy person in the world. If I do this, then people are going to be even more critical of me. So again, it may not even be what people are thinking, but you are going to think it about yourself. So that self-stigmatization process is a barrier as well. So there's the stigma that does exist, not denying that, but there's also that process of that the illness itself pushes you to self-stigmatize as well. Yeah.
So you bring up a very good point. I haven't had an opportunity to speak to a qualified clinician and consultant about this. What on earth is going on with our brains that self-sabotages like that? Why does depression or anxiety or other mental health conditions almost do this? Our brain does this thing and our body does this thing. Our biochemistry says, actually, we're going to make it as hard as possible for you to get help. Like, what is that about? Like, if you've got a broken leg, you struggle to walk. It's not like your body goes, oh, okay, do you know what? It's broken, but we're going to pretend everything's all right, so they don't know about it for as long as possible. What is going on? Why is it so challenging?
I think it is the certain mechanisms that exist there for good reason. So let's imagine a world in which you weren't anxious about anything, ever. So, if you think about the consequences of not being anxious about anything ever, then you would put yourself in very dangerous situations quite readily, or you would do things that could potentially be quite harmful. So if you have no fear of anything, then you would do fearless things. And we do have people, it's very, very rare, but it does happen, where they have almost no ability to detect hazards. So it's the opposite problem. You see what I mean? They become anxious about nothing. And those people, you have to really support and help, because they could put themselves, they become reckless. They can put themselves into very dangerous situations as a result of that. So anxiety is a mechanism that is trying to protect you. But in a person who's anxious, that mechanism is not working correctly, is over-identifying risk. So you are going to feel threatened almost by anything and everything. So your threshold is set at the wrong level. So if I talk about this and I reveal that I am perhaps suffering or weak or something, then I'm much more likely to become a victim. So my detection of risk is firing inappropriately. And even just the admission that my detection of risk is firing inappropriately becomes a reason for it to be triggered, so for the fear itself. So you're fearing of seeking help, you're fearing what they're going to do because you anticipate all kinds of disasters, you're fearing what they're going to think of you. So it is because of that feeling is amplified in the illness that it becomes a barrier. Actually, you say that it doesn't happen in physical health conditions, but it can do. It can do. Like, for example, sometimes in chronic pain, we see something very similar, that your body tells you not to move, when actually the solution is to move. You feel that you're going to make it worse by walking, when actually we know for a fact that to resolve chronic pain, sometimes, even if you still have a lesion, is to actually mobilize, which is quite difficult to wrap your head around. So it can happen in other conditions, not just this, that you're self-sabotaging in this particular way. Depression is very similar. Depression robs you of all your energy, of all your motivation, of all of that. So your motivation to seek help is going to be also compromised, right? And also you are hopeless. So even if I seek help, it's going to be for nothing. That's the next step. So you have to the illness itself becomes its own barrier for those reasons. So you might say, what is going wrong in depression? Depression, feeling low, has also quite a good value. So imagine that you never became sad for anything at all, and how inappropriate that would be. So if you have something going wrong in your family, if you have somebody, a relative that is ill, and you never became sad, that would not be normal. So you wouldn't be human, right? So you wouldn't be able to sort of do those things that are normal to humans, like grieve or feel sad when things are wrong. And that is part of the mechanism there, is to try and avoid those situations that make you sad, because it really sucks to be sad. So you want to sort of avoid that feeling, right? So there's mechanisms to say, okay, so what can I do to avoid this situation that is very, very sad? What can I do to help myself and help those people around me to avoid these situations? When that misfires, it just everything, so that you have no hope that anything is ever going to work. And basically you get trapped into that rut. So they're both normal things, absolutely normal human experiences, that the illness makes working in an inappropriate way. So it makes them misfire, as it were. And that becomes its own barrier, its own challenge. And interestingly, it is about overcoming that initial barrier is a very, very important step. So when you're seeking help, overcoming that initial barrier, forcing you, in spite of what you're telling yourself, to take that first step that actually may help you actually then recover, because then you show to yourself that it is possible and that it's not as terrible as you thought. And that can be a very important piece of evidence for you to sort of overcome other things as well. So the mere fact that it wasn't as terrible as you thought it was going to be when you sought help. And that's the purpose of Thrive, to make it as really as seamless as possible, make it as easy as possible, so that you don't have a terrible experience there, so that we can try and guarantee the best experience possible when you're trying to seek help. So that you already proven to yourself that the reason for your anxiety, it might be misfiring, so it kind of reveals that to you, or this hopelessness that you have may not be working appropriately again, so it may not be healthy. So there's healthy sadness, unhealthy sadness, there's healthy anxiety, unhealthy anxiety. It is about discovering that and fighting against the unhealthy version of it.
If you're enjoying this week's episode, consider heading over to our website and supporting our ongoing work in destigmatizing mental illness and creating a healthier, happier, and more sustainable industry by purchasing some of our branded merchandise. We have a whole range of t-shirts, hoodies, chef's jackets, wellbeing journals, plus a whole host more available on worldwide dispatch. All funds raised from sales of these items go towards free-to-access e-learning content, as well as providing free support systems and help for those who may be experiencing difficulty with their mental health.
Thank you. I think that a lot of our audience will benefit from that massively. And there was something that you said there that resonated with me. So I've experienced a few episodes of mental illness in my past. So I've experienced a depression multiple times.
Yeah.
But there was one example when I was 16, 17, I think hormones, I was quite a deep thinker at the time. I remember very clearly, I come to the conclusion that there was no point in existence. And it was such a weird thing. And I remember at that moment sinking, and that sunk me into a year, quite a bad depression with hopelessness, insomnia, tearfulness, all of the above on a regular basis. Yeah. And then paranoia, and started to isolate myself. But there was this weird stage. And because I wasn't old enough and I didn't understand what was going on, there was this weird stage where fight or flight not fight or flight from a biological or medical term, but there was this click in the brain that said, if I don't get out of bed and challenge myself just to brush my teeth or do my hair, I'm going to stay like this forever. And over the course of sort of 2 years or so, I started to crawl out of that depression by putting myself in unfamiliar and uncomfortable situations. And it started being, there's no point in getting out of bed today because there's absolutely no point, to starting to look forward to tomorrow. Then I'll start to look forward to the weekend. And suddenly that horizon, as my horizon started to expand, the darkness started to lift as well. And I started to look forward to next month and, what can I do in 6 months' time? I was very fortunate because I didn't require medicine or psychiatric help in that instance. But I do clearly remember that I've got two options here: stay like this forever or do something about it. But that was it was carnival. It was something within me that actually drove that. Not, what do I know about it? 16, 17 years old? Nothing. So it had to be something that was just a mechanism within me that went, come on, And it really resonated.
Yeah, no, I mean, so interestingly, one of the key things, and I think that's a valuable thing for people to understand, one of the key things in order to recover is to do things that are uncomfortable and difficult. And that behavior, just the behavior of doing, like brushing your teeth, getting out of bed, that is a big part of the recovery, even when you don't feel like it. So one of the key roles of the therapist really is to try and motivate you to do really hard things. Because sometimes, in your case, you were able to motivate yourself. And obviously depression, you can recover spontaneously. Most people do recover spontaneously. So what we're trying to do here is to reduce the time it takes you to recover, and also to give you tools that will prevent that from happening again in the future. So those two goals that you have, let's reduce the time that you're suffering, really, as much as possible, and then also give you some tools that may prevent it from happening in the future. So those are the two things. But I think it's very important. I don't think it was pleasant to you when you first started doing that. It was probably required a lot of effort and energy, and you were, knackered, and it was really, really hard. That is the shape of recovery. It's not that we're going to have a nice chat together and magically you're going to get better. It's not that. It is about me showing you some techniques and motivating you to use them, and for you to learn them and practice them, and to do things that are uncomfortable and difficult in order to gain that recovery. I think that's very valuable for people to hear, that experience that you had. So you can have a natural recovery. And then I think that was your own brain trying to heal itself, and finding that way through. Yes.
It's incredible, isn't it? It really is. And I think that I've always had an interest in how the brain works since that stage, but it was only later in life that it's just such an interesting... There was a book, some people like him, some people loathe him. Johann Hari wrote a book about lost connections, and there was a specific story in there. Whether it was true or not, I wouldn't like to comment, but it was about how there was a study on monkeys in Africa, on stress levels and cortisol levels and serotonin and things like that. And they said that depression and or anxiety has going back to what you were saying, it has a purpose. And when an alpha male gets effectively unseated from its position within hierarchy system of monkeys, it starts to feel elevated levels of stress, which makes it more heightened to dangers and risks because it doesn't have the protection of its community anymore. And thus then it's more alert for, tigers and lions and things like that, because all of a sudden it's not part of a unit. And whether that's true or not, I don't know. But I always found that quite interesting, is that actually it is a mechanism that is designed to help keep us alive and to help us survive when it's working well and for periods of time, not for extended periods of time, which I think is the very key definition of illness versus experience, right?
Yeah, I mean, I don't know about that study, but what you're saying is, we know that is true in humans. Like, people find it hard to understand why teenagers in particular find social anxiety so distressing. And the reason being is very similar to what you're saying. So if you don't manage to click with your group, let's imagine 100,000 years ago, before podcasts and technology and all of these things that make us a lot safer and protect us from many, many things that we would have been exposed to much earlier in our history. So before then, you had 150 people around you that could keep you safe from tigers and lions and everything else. If you don't click with them, if you somehow become ostracized, then your life is at risk. So it is a life and death thing. So if you don't manage to find a community, then you're really, really in trouble as an individual. It's no wonder that we find that social approval so important, particularly when we're younger, and so challenging, and why people suffer so much with that. I mean, one of the things that is interesting is that those systems that are there to protect you, they evolved in a situation that is not our current situation. So we find ourselves stressed out by things that are not really life-threatening. But it is because those mechanisms have to act that they get triggered by things that are probably far less threatening than they seem to be, because nothing else has triggered them. Your threshold was set at a different level. So if you're in an environment where every day you might encounter a predator, the threshold for, this person was nasty to me today, how threatening that is versus, I have to go out there and maybe face a predator is very different, right? The threshold for what makes you anxious and what doesn't make you anxious is set at a different stage. If you're very sheltered and protected, those mechanisms are still there. They're still going to be activated, but they might be activated by a letter from the council saying that the neighbor has put in a complaint because you didn't do the right thing with your bins. Do you see what I mean? And that can be really, really distressing. If you analyze it, it is because those systems are still there and they're still trying to protect you. They perceive that as a threat. But if you sit down and reflect on it, your life is not in danger. Even though when you have a panic attack, it feels like you're dying. Right? Do you see what I mean? So it feels as threatening as a predator in the bush. So a lot of what you do in therapy is to learn about that response and to learn to recalibrate it for yourself, to understand that it is a healthy, so having anxiety is healthy. That is not, people call it a negative, the negative emotions. I really hate the expression negative emotion. It's not negative. It's whether it manifests itself in a healthy way or an unhealthy way. Healthy anxiety, so if you get really nervous about being run over by a bus, perfectly healthy thing to be worried about, right? If you get really nervous about a strongly worded letter from your neighbor, not so healthy. I mean, yes, of course, trying to resolve the situation with your neighbor, but it's not life-threatening. Even though it might feel to you, if you're really anxious, it might feel to you like it's life-threatening. That is the thing, is to try and recalibrate those thresholds so they are healthy instead of unhealthy. People say anger is negative. Anger is not negative. Anger can be very destructive, but it also means that when somebody is impinging on your rights and you're rightfully angry and you act appropriately, anger is very healthy. Imagine that you don't get, I mean, if I'm taking advantage of you, Chris, and you don't get angry with me, then you become extremely vulnerable. So you see what I mean? So it's not a negative emotion. When it's right and in the right context, is a very healthy emotion. So you should be angry if I'm taking advantage of you. You should, right?
Yeah.
What you shouldn't be is excessively angry or angry in inappropriate state. So a lot of the work is about figuring out that these are not negative emotions to be suppressed. They are emotions that can be healthy or unhealthy. And how do we understand them? How do we process them? How do we reflect on them? Yeah.
And that suppression is dangerous. I spent years suppressing feelings and not acting, not impulsively, but always double guessing myself. And ultimately, that's what ended me in therapy, because you suppress everything for so long, you actually forget which way is up or down, and you just don't know how to act. So it's a really, really important thing. And trusting your natural instincts and gut instincts. And sometimes they may be, thwarted, or the instinct may be changed by early life events, etc. But actually, we have these thoughts, feelings, emotions for a reason. It's because we're animals, we're biological organisms that are responding to our environment. I'm currently applying to be a retainee fireman at our local fire station because they're looking for a day cover. And I was chatting to one of the fire crew this week, actually, and he was saying the most interesting thing about being part of the fire service is, he says, you see some horrendous things. He said they're really, really terrible. But he says, over the last 4 years of this particular individual, he says, my resilience levels have skyrocketed, because if you are a human being and you're driving down the road and you see a car accident, you're immediately in fight or flight. But he says, now I don't have that response. I have a process-driven response to that, which allows me to be more effective at being able to help and aid people because I've had exposure to that. And for me, again, like, that's unlocking a whole new part of my brain. I'm like, yes, I need that. I need that in my life.
Yeah, and it's about what we were saying, about what I was saying in terms of setting the threshold. So by doing something like exposing yourself to these difficult situations in which you're going to do extremely meaningful things, to try and help somebody in distress and somebody who's really been injured or whatever, then that is it's going to definitely bring meaning to your life. And one of the things that you can do that is very protective is to do something like that, to do something for others that is difficult and that requires for you to be in a situation that we wouldn't like ourselves to be, but it has a definite purpose, that helping somebody else. So that's going to be helpful in itself. But just being exposed to how bad things can go lets you kind of put into context that when somebody is a bit stroppy with you, it's not as threatening as you thought it was initially. There are situations that are a lot worse. So in my case, it was during my training, being in casualty, being in the emergency department, dealing with things, that really changes things, or being on the wards, that really changes things. And then as a psychiatrist, looking after extremely ill people in very difficult circumstances also kind of changes your threshold. So again, I know what a real emergency looks like. So having to pay the bill for whatever is not a real emergency. I'm sorry. A real emergency is like something like what a fireman would encounter and what the doctor encounters or what a nurse encounters when somebody is like really unwell, right?
Yeah.
That's a real emergency. If you want to be effective, you have to be good at telling the difference between those two things, right? Between this is a real emergency and we need to act now, or this is not an emergency and what we can do is take a step back and try to sort of be systematic about things and do the right thing, not panicking, not knee-jerking into doing something that is not appropriate. So absolutely, sure. I very much commend you for doing that, and I think it's a great idea. And I think it'll be helpful to others and definitely helpful to yourself as well. Yeah. So
thank you. I mean, listen, there's quite a lot of training involved, etc. But there's a selfish reason for this, which is how much more can I learn about myself, and how much more effective can I be in general life? But also, I don't know, I've hit this stage in life, like with the Burnt Chef project, where I want to give back. And we help people around the world on a regular basis when it comes down to mental health and well-being support. But I think that I can still do more. And I think that I can still contribute to community and find increased person. So I'm curious to see where that journey goes. I've still got 2 weeks of intense training to be able to get at least on the development program. So, but enough about me. This podcast's not about me. I just thought it was quite interesting, that exposure piece. So let's talk about the Burnt Chef project. We've been working with Thrive now for over 2.5 years, possibly even longer now. And we provide Thrive to, firstly, our ambassador network, our volunteer network, which is jumped up massively in numbers over the last year or so, but we also provide it to clients as well. And whilst all the data is anonymized and we can't see necessarily who's calling or where they're calling from, whatever that is, and that's an important distinction to make here, we do get to see MI reporting and general themes, etc. And you had some quite interesting takes when you were comparing the hospitality usage rates and engagement rates and recovery rates versus other sectors. And I'm very keen during my conversations to explain that every sector has its challenges. You know, whether you're a farmer or you're in the legal profession, there are stresses, there are rates of burnout, there are mental health issues, whether they're caused within the workplace or externally. But hospitality is quite unique. And I just wondered if you could speak about that a little bit.
No, we do see a difference for sure. So if you compare it to other sectors, we see a few things that are quite striking, actually. So we see a higher level of morbidity. What I mean by that is that the amount of people affected by symptoms of anxiety and depression in particular, but mental health disorders in general, is greater than in other sectors. And I'm doing this from memory, but something like a 30% more, really. So it's not a little bit, it's quite striking. The other thing that we do see is that the way the app is set up, so you download it, you do a little bit of a screening, that's the first thing that happens. And based on that screening, we may recommend that a therapist gets in touch with you. So we don't recommend, so we just alert you, but the therapist automatically gets in touch with you to try to remove all the barriers. We were doing it differently at the beginning, but we learned that doesn't work so well. And what we do is we reach out ourselves. So we reach out. And what we measure is the response to that. So how many people that you reach out to then say, yes, I'll have a conversation with you. Yes, I'll have a chat. In the hospitality sector is usually lower than in others by about 10%. I mean, it sounds like not a lot, but it's a lot. We normally achieve rates of help seeking around the 80%, which what we mean by that is if I reach out to you, we get about 80% of people sort of reaching back. In the hospitality sector is 70, sometimes less, depending on the specific client, sometimes less, which again is a bit disheartening. So somebody took the first step, which is already difficult to download the app, and then we don't seem to manage to sort of make that connection that unlocks that first step, as well as in other sectors. So greater level of morbidity, greater level of symptoms, and also we see fewer recoveries. And the reason for that is that the engagement with the program is less than in others. And one of my hypotheses about why this happens is the very erratic nature of the hospitality sector, where you have shifts and you have things that like hard, It's how to schedule a session. It's about what can we do? My constant question here is what can we do to make it more flexible, to make it more able to sort of cater to those needs? Is that what is actually happening or not? So for me, one of the things that I'm keen to do, and we haven't talked to you about this, but maybe I'll say it now, is to try and do some kind of at least a qualitative study. So a research study. We've done a few of these studies with hospitality workers that may have these symptoms, to understand what are the barriers that we're not really overcoming. We do very well in other sectors. Why are we finding this hard? So I think we still do very well. I think we still produce good results, but it's strikingly difficult, this sector. And I think it is to do with the shifts and what can we do to overcome that? Because we tend to, for example, in most cases, we tend to schedule a series of appointments. But in the hospitality sector, maybe people might be working by the hour and it might be very hard to find a slot that is consistent. It might be very hard to find a slot that cannot be taken away all of a sudden because, you are scheduled to, somebody is off sick and you're called in to cover a shift, things like that make it particularly hard to provide support and help to the people in the hospitality sector. That is an open question for us. We have been observing this, and we have now, because we've been working with you for so long. So the next step for us would be to try and do those focus groups, those interviews, to figure out whether we are on the right track thinking about this, or whether there's something else that we don't even know. That is a challenge for people in the hospitality sector to seek help and to obtain the help, and to, once you've obtained the help, to remain engaged until you obtain a recovery, which is what we normally are able to do.
Yeah, I think it's a hypothesis. I think it's a very strong one. We echo that, and we see that when it comes down to workshops are a prime example. We might have 15, 20 people booked on a workshop, and then 3 will turn up on the day. Now, that might be that they have a day off and that they're tired and they need to rest and recover. It might be that there's a sudden change in demand and shift patterns have had to change, or sickness or absence. It might be that they just didn't even get their rota planning less than 24 hours before the shift was designed to start. So I think it makes sense with other research pieces that we've done and surveys that could be that. I wonder whether or not there's and again, I'm hypothesizing here as well, but there's a team culture within hospitality that's often within we tend to talk about being in hospitality, boots on the ground, and we're at war here, but actually we're feeding and watering people, right? That is in essence. We're not saving lives. We're helping improve, but we're not saving. And I think that tends to breed a culture that is, I haven't got time for this. Almost a self-sacrifice in order to be able to keep the motor running far to ourselves, which it's a very odd thing. And we see that when it comes down to saying no and having healthy boundaries in hospitality. It's very challenging to do. We're programmed to be yes people in many respects, which then compromises our own personal boundaries. It compromises what we were talking about earlier about feeling emotions, because you tend to swallow it, and that gets heavy at times as well. So we'd be keen to work with you on that to see if we can help improve. Because ultimately, the great thing for us about Thrive is you're proactive. It cuts straight through that stigma or self-barrier by a therapist messaging you and going, hey, things aren't looking as great as normal. That's absolutely fine. We want you to know there's help here. And I'm ready and available to have that conversation with you now. Don't worry about searching for it. So that is tremendously beneficial. But we need to get people actually through that recovery journey and to find out how we can improve that. And 70% is still higher than the NHS. It's
really good. It's really good. I mean, it's just in comparison to what we obtain in other. You see what I mean? That's the thing. So, normally your help-seeking figure is around the 20% mark. So, yes, it's still really, really good compared to a baseline. But we know that we can do better. And it's a shame that for whatever reason, I told you at the beginning that one of the commitments that we had is to try and make this as accessible as possible, as easy, trying to remove as many barriers as possible to seek help and to obtain the right help at the right time. So obviously there is a problem here. There's a challenge that we need to sort of figure out and overcome. I don't think we know enough. I think I have thank you for sort of like validating some of my thinking, but I'm really not sure. I think we do need to sort of look into it. And it is distinct, I would say. And it might be about that. It might be also about, I don't know if employers will be very receptive to this, but we do talk to other employers and we say, look, you need to make time to, somebody who's going through a program, they do need the time, and it's probably best that you do a lot sometime. So people go to the GP and think nothing of like taking half a day. We only need like an hour, can we do this? Because it is remote, so we can do it. So all you need is a private place and an hour. So you don't even need to leave to have your therapy. The other thing that I would say is, I think is very valid, is that let me sacrifice myself. I think self-sacrifice can be important, like when you're a firefighter or when you're a doctor and that sort of thing. It can be important, it can be very meaningful. But if you are overdoing it, if you're sacrificing too much of yourself, then there will be nothing left. And all of the good that you're trying to do is going to, wash away, disappear, because you're no longer able to sustain it. So yes, fine, I understand the impulse. Believe me, I've been on call for many hours sometimes when I probably shouldn't. But it's about that balance. It's about, you do need to, in order to be the most effective, in order to sort of help the people that you want to help and make their lives nice and enjoyable and all of the good things that we get from the hospitality industry. I mean, I love going out to eat with my family. It's amazing. It's really good. We're really lucky to live in a time that is commonplace and easy and very rewarding, and, high quality places and high quality service. Fantastic. But it cannot come at any price. You need to sort of think about yourself and about how sustainable is this? If I push it too much, then I won't be able to sort of help anybody or do this very nice thing, very meaningful thing for others. So yeah, I think that's important.
This is an important skill. It's not one that my generation was taught. I mean, I'm close to 40 now, and I definitely wasn't taught about actually how do you maintain.
I'm not one to speak. I'm 50, so.
Our generation,
just as bad.
Mental hygiene, mental fitness, what it takes to make sustained performance. But I use the analogy, I used to use Olympians, but I've started to use pilots now. Like, you wouldn't expect a pilot to fly around the world, stop, have 2 hours break, a quick cigarette, jump back on the plane and fly another 300 people around the world again.
That would be unsafe.
It would be unsafe. People go, well, that's ludicrous. Yet we're expecting people to be in environments that are with sharp implements, that are hot, that are noisy, that potentially, you could harm yourself or harm others.
Yeah.
And yet we put that in the way. And there was something that you mentioned earlier, and I'm just going to bring this to the forefront, and we can certainly look at this externally because I appreciate that time is ticking on. But we hear so many stories, especially from a chef's perspective, of times where there's a serious burn or a cut, and they've bandaged it up with a bit of plastic or cling film for the time being. And then when it's got too severe, they've then had to go to hospital, but only as a last resort. And then once they've gone to the hospital, they come straight back into the workplace to finish the shift. So that's the sort of thing that, and it's getting better, but that education for employers to understand that, yes, you might be down a member of a team for an hour for therapy or for 2 hours for an emergency appointment, or etc. But actually having a team member who is back at the workplace, feeling better, healthier, lower risk of presenteeism, lower risk of absenteeism as well, which is the number we can calculate. But when we look at presenteeism in hospitality, the predicted rates, because it's a very difficult one to challenge, but the predicted rates are so flipping high. We need to educate business owners that the more time off that you give team members, the more profitable your business is going to be, because you'll lower your turnover risk, you'll lower time off of work, and also presenteeism. But that's a really, really hard sell for an industry.
That's the trouble. And I think that is part of what we see in our figures, that they're not able to sustain it for reasons like what you're describing. Again, we don't know for a fact because we haven't done that piece of research, but it sounds like a plausible explanation for why we see this difference between the hospitality sector and other sectors that we work with. Definitely. Well,
we'll continue to champion the businesses who are doing the right things. We're doing some work out in Dubai at the moment, and their turnover rates are 20% compared to the industry average in the UK, which is 76% turnover rate. So we're keen to try and find out the nuances and celebrate those. But I'm so very pleased that we have this conversation. It's been thoroughly enjoyable, and I really, really appreciate your time. And thank you. I'm sure our listeners are absolutely going to love this episode. So thank you very much.
I really enjoyed it. Thank you, Chris. Thank you for inviting me. And I hope that some of what I said resonates with people and is helpful. So thanks for inviting me.
Thank you.